improving access to fertility preservation for breast cancer survivors here in California. Okay, so this symposium is really a community and academic partnership. And this is between the Alliance for Fertility Preservation and our group here at UC San Diego. I know that both you'll hear from Joyce and Sierra. Joyce is our executive director of AFP. Sierra is a professor of public policy in the School of Public Health here at UC San Diego, and I sit in the School of Medicine in the Department of OBGYN. I'm a reproductive endocrinologist and epidemiologist by training, and I also currently have the hat of the Associate Director for Equity, Diversity, and Inclusion at Moores Cancer Center here at UC San Diego. So I get to introduce the symposium. And here's the why. And I think most of us know that by age 45, about 1 in 20 females will develop an invasive cancer. And really, breast cancer is the most common of these cancer types. 5 years out from cancer diagnosis, at least 8 out of 10 women who have cancer will be long-term survivors because of the advances that we have in cancer treatment. But these treatments often affect the systems that we need for fertility. So chemotherapy is toxic to the finite number of eggs that we have. Long-term endocrine therapy, it is not directly toxic, but it also prevents pregnancy, and there's concomitant reproductive aging happening at the same time. And more than ever, some of these targeted therapies that are long-term therapies can be teratogenic, and so you can't conceive while you are on those medications. And so for many reasons, there are indications for why some women need fertility preservation. This is because fertility preservation services can prevent infertility. Cancer survivors actually really have good options for fertility. Among these fertility preservation procedures for females, the options include freezing eggs, freezing embryos, ovarian tissue freezing, ovarian suppression, fertility sparing surgeries, and ovarian transposition. But you need to be able to access care in order to undergo these services. So oncofertility care involves counseling patients and families who are affected by cancer about their future fertility, and for the people who need it, referring them to fertility preservation, and for the people who then need it after their oncofertility consult to undergo fertility preservation services. So this involves talking to every patient at diagnosis, and not only at diagnosis, and as you guys will see from the new fertility preservation guidelines from both ASCO and ASRM, it's really talking about fertility and reproductive health through the whole continuum of survivorship. Being able to have fertility specialists that patients can access, and then ultimately being able to undergo these services. We and many others in this room have done some of the work to demonstrate the many barriers and facilitators that can be along this journey. And we know that some key barriers include patient-clinician communication, lots of clinic-clinic coordination, fertility specialist access, and at the end of all of it, financial hardship from either going through treatment or actually not being able to go through fertility preservation services. It turns out that there are a lot of factors that are barriers to optimizing reproductive health care beyond just the patient themselves. And so this is really a multi-level challenge. And so what we're showing you is today we will hear from patients, we will hear from the clinical context in which they receive care. We will think about the insurance landscape for how to access some covered services, and then really the laws and big P policies that help to regulate or facilitate some of these processes. And the understanding, hopefully, is that contextually the organization at these multiple levels work. Then we will improve oncofertility care and therefore improve the reproductive health of young breast cancer survivors. One of the most significant policies to improve oncofertility care has been fertility preservation benefit mandates, which are laws that require some health insurances to cover fertility preservation services. Since 2010, 37 states and the District of Columbia have introduced legislation. And the Alliance for Fertility Preservation has this beautiful map for anyone to see, where yellow are the places where the states that have introduced legislation. Green are the 18 states in the District of Columbia that have passed mandates. And this includes California with Senate Bill 600 that was passed in 2019 and became effective January of 2020. And you'll hear from Senator Anthony Portantino more about the evolution of this particular law. Today, we will look at the experiences and data on how well these laws are working. So as an introduction to insurance at 9:07 a.m. on a Friday morning. So not all insurance types are subject to state mandates. And I think what we're trying to show you here is on the left are the types of insurance plans that would be subject to a law in California. So fully insured commercial plans, Affordable Care Act plans, and Medicaid-based plans. On the right, if you're a self-insured commercial plan in the military, a federal employee, or a part of Medicare, those are not subject to state regulations. So off the bat, a state law, the best it can do is to cover those members who are one of the three groups on the left. And when lawmaking occurs, after all the dust is settled and trying to pass this law for many years, on the left is where SB 600 sits, which is currently, it covers people who are fully insured commercial plans, Affordable Care Act plans. It excludes Medicaid. On the right, through other benefit or other advocacy and rulemaking, there are some self-insured commercial plans where employers decided we are going to include fertility preservation benefits. This is why you're seeing that in yellow. In the military, active duty military members have access to fertility preservation in this setting. Federal employees have had a benefit for 2 years now, and Medicare is not included. So this is the context, and now like the mechanics of how today is going to work. Our goal is to gather and summarize the evidence relevant to oncofertility care of young breast cancer survivors in California. And the reason why we want to do this is because we want to generate and disseminate key evidence for policymaking in order to derive policy recommendations to improve care delivery. And our question is oncofertility care accessible and is it affordable? And so the agenda for today, and I think my team asked why there was this dude here on the slide, it's Flash, because we didn't want to bore anybody. We wanted to go, lots of talks that are 7 minutes each. And most importantly, a time for the panelists to really debrief on what it is you heard to try to derive some recommendations. But on the right, we will keep you fueled throughout the day because that is our mission, is not to have people go hungry here. The format of the small groups is to interact with each other to digest the vast amount of information in short spurts that are coming and augment the information with your individual perspectives, experiences, and knowledge, and identify ideas that are going to be really gold for the 2 questions of the day. 1, what are the gaps in knowledge in oncofertility care delivery? 2, what are the key policies that support equitable oncofertility care? We are super fortunate that so many of you are invested with us and that we have partners with lots of different lenses today. We have young survivors and families. We have people who are researchers. We have folks from all over the US, clinicians, advocates, policymakers, insurers, policymakers, and on the right, not least, we have a number of students and trainees who are looking to us to see what the future might look like for this field. So you each have packets of pink and yellow stickies. And this is our task. As you're listening to talks, would you mind writing down in yellow research questions, 1 key research question, or any research questions you have about that talk? And in the pink, any policy recommendations that you feel is super important. And an example of a gap in knowledge is how affordable is fertility preservation? Who's eligible? An example of a policy recommendation is what are changes in a clinical policy that will improve care delivery? For participants on Zoom, please post this in a chat, and we thank you in advance for your engagement. Housekeeping, as I'm seeing my 1-minute mark. This is Sebastian Cuevas. Sebastian is our timekeeper today. So when he flashes that 1 minute as he did 10 seconds ago, that's 1 minute. 30 seconds. Okay. So we have 4 rooms for breakouts. On your stickers, you will see what room for the breakout that you are in. We have students who are guided to these 3 rooms for a breakout. The restroom is right behind us, stairs on either side, and elevators can go up and down instead of also walking And if you have questions, Zoom chat to inform the frequently advised questions page. And finally, I can't even begin till I go through the list of people who are here and who are engaged. So we want to thank you very much, and also thank the California Breast Cancer Research Program for thinking how important this topic is and bringing us together. And it's time to stop. All right. And actually, I'll take an extra 10 seconds to sort of think about our colleagues and friends and people we know in Los Angeles, and hoping that they and their families are safe today. Okay. So if I may, I'd like to introduce Senator Anthony Portantino.
Morning, everyone.